You may have noticed a stomach bug doing the rounds, with surges usually happening between November and May. Cape Town health officials say there's been a big spike in diarrhoea cases year on year, especially amongst toddlers. Authorities blame the hot weather and warn without proper hand washing and enough drinking water, dehydration and diarrhoea can lead to unnecessary deaths. To gauge the situation further afield, we've managed to book an appointment with Life Healthcare's emergency medicine specialist, Dr. Charl van Lochrenberg. Doctor, thanks so much for joining us. I don't know anyone who hasn't had this tummy bug, and it seems to be going on for longer than a few days. It goes away and then it comes back, and it's been a real pain, actually.
Indeed. Unfortunately, the scenario is actually seasonal, and this is not an atypical situation. During the summer months, as you correctly point out, we do see a spike in diarrheal and gastrointestinal diseases, and that's actually perfectly normal. The numbers that are probably causing a little worry are because we're comparing to years recently where we've had COVID lockdowns and distinctly unusual social circumstances. Kids away from school, kids in isolated bubbles at home, for example, and behavior particularly being quite constrained in terms of normal interactions. So I think if we go back a couple of years, chatting to colleagues at the NICD that look at surveillance of these cases, the numbers are actually not too surprising. And it's probably more a function of a return to normal type of behavior. And now we need to really just up our game in terms of management of these cases and making sure that people understand how they spread and more importantly, how they can prevent them.
How do you stop, Doctor, the tummy bug coming back? That seems to be one of the main complaints that I'm hearing from people in my social circle.
Yeah, it's about understanding how that tummy bug, as you refer to it, what it is and how it's spread, quite simply. So the bugs are various. There's not one specific infectious agent that causes acute gastro. We think of a good number of viruses, not coronavirus, other viruses that have got unusual names, and bacteria, right from the more scary salmonellas that cause typhoid to milder bacterial infections. And these are spread from people to people, person to person, typically through contaminated water, hygiene sources not being accurate, and for example, how toilets are managed in particular communities. Those bugs will then circulate and reinfect. Food handling is another common area where these particular infectious agents can spread. So what's essentially happening is the bug is coming back, or the infection's coming back, because you've been re-exposed via a contaminated water source or poorly prepared or poorly stored food. And that really zones in on how we prevent things, right? So you're not going to catch gastroenteritis from a clean municipal water source or bottled water or water that's been purified. Even simply boiled water is perfectly purified water. That's not where it's happening. It's further downstream where people have not been able to get access to clean water, for example, or food is not being properly stored, or simply hands are not being washed pre-eating or pre-preparation of food. And that's the simplest way that these bugs then recirculate in the community.
Doctor, why are some people more susceptible to contracting these bugs than others?
Well, that's a how long is a piece of string type of question, really. People that have got underlying comorbid conditions, for example, other diseases underneath, we think often of the diabetics, other viral infections, they generally make you more susceptible to an acute viral or acute bacterial infection, and also a status of nutrition. Healthy people, well-nourished people have a stronger, more vigorous immune system, and they're certainly better equipped to fight off community insults from general bugs that are in the environment. So certainly just general health and wellness is probably our best safeguard, and vaccinations against bugs that we can vaccinate against in the community, in the environment, and that's certainly a good safe strategy.
There have been a few cases of typhoid in the Western Cape and outlying, but surprisingly to me, I know quite a few people who've contracted it in urban areas, and they say they think it's from food handling, eating salads and things like that, fresh uncooked foods in restaurants. Any truth to that?
Yeah, certainly I couldn't comment on any truth about those sources. One thinks of the historical Typhoid Mary story, if you like, or history story. That's the lesson that we learn. And yes, food handling is a common area for that particular bug. It's a salmonella bug that causes typhoid to be spread. And the easiest way to interrupt it is clearly to have clean water sources for preparing the food and making sure that the food's been appropriately prepared in that restaurant or kitchen environment. So we certainly haven't seen a significant number of those cases, not anywhere in the country reported in the different surveillance channels, but it's really about kind of focusing on the reliable sources of food and water for people, and then certainly we can reduce the infection risk.
People in urban areas, doctor, or suburban areas, should I say, are going around who've got this diarrhea saying there's definitely something in the water. Is that a kind of urban myth, or could there be something in the water?
Honestly, would have to say there's definitely nothing in the water. South African water, municipal water supplies in the various urban cities are excellent. We've got wonderful sort of quality control processes, and I'm super reassured to drink water and clean my teeth from municipal water sources. And as we said earlier, you know, municipal water, bottled water, and boiled purified water, perfectly good sources. Absolutely nothing to worry about in terms of sort of prepared water sources. Always be a little bit more suspicious if the water is uncontrolled in terms of a source. And those are the situations where we look to take matters into our own hands, prepare properly, clean the water, pre-boil it if possible, and that's certainly the right strategy.
Tell me if I'm right in this summary. It's seasonal, it's not unusual, and it's probably in tandem with us returning to normal, a little bit more than normal in terms of sanitation and non-mask wearing post-COVID.
Spot it. You got it 100%.
I was listening. All right. Thank you so much. That was Johannesburg Life Healthcare Emergency Medicine Specialist, Dr. Charl van Lochenberg. Thank you.